Republicans are heading us into a shutdown. We stand at the precipice of a government shutdown because Republicans are not serious about keeping the government open. If you want one glaring instance of that, Speaker Johnson sent his people home. They're home right now, even though the government will conclude at midnight. There's only one conclusion you can draw when the Speaker sends the House home, that he wants a shutdown. He doesn't want to negotiate. All they want to do is force us, try to bully us, and they're not going to succeed, into taking their partisan bill, take it or leave it.
With a government shutdown on the horizon, tensions are high on the Senate floor. Watch as Senate Minority Leader Chuck Schumer calls out Republican leaders for blocking crucial negotiations and warns of skyrocketing healthcare costs. Will bipartisan talks save the day, or will partisan gridlock push the country to the brink? Find out now.
Thank the leader for letting me borrow his chart for a minute. So he's pointed to each of these bar graphs, percentage of Democratic senators who supported Biden in their CRSs. Yes, that's true. Guess why? In each case, Democrats negotiated with Republicans and said, let's have a bipartisan bill. The leader says it's a clean bill. It's a partisan bill. Not once were Democrats asked for what input should be in the bill. We were not told about it. We were not asked about it, etc. Nor did Speaker Johnson talk to Hakeem Jeffries. You cannot pass legislation in the Senate when it comes to appropriations unless it is bipartisan. So the leader will say it's clean. No, it's not clean because there was no discussion. Every one of these times I went to the Republican leader and said, what do you need? What do you want? And in many cases, we had to significantly change the bill. One of our bills had aid to Ukraine. The Republicans didn't want it. To avoid shutting down the government, we talked to them, negotiated, and took it out. But not once was there any bipartisan discussion or talk on this bill. We wanted to give our Republican colleagues a chance. That's why some of us back in March said, okay. But we saw what happened after that. We saw a decimation of health care in the BBB. So bad right now that 80% of Americans support renewing the tax credits of the ACA. We saw them use rescissions, pocket rescissions, impoundments to undo what was done in the legislative process. So the world has changed, but that one way it's changed, and there are several, and I'll get to those, one way it's changed is there was no discussion. And we asked to have meetings. Hakeem Jeffries and I asked the leader and the speaker to sit down with us as early as July. They didn't. The job of a leader is a bipartisan negotiation. And the appropriators, which you'll say are discussing things. But the two issues we care about, extending the ACA credits, broadly popular with the American people, so they don't want to talk about it, they want to change the subject, and ending these rescissions and impoundments, which would undo what we would do. The four appropriators, when they got down and discussed it, they said that should be for the four leaders to discuss. That's what Thune said. That's what Cole said, the Republican head of appropriations in the House. That's what Collins said. That's what Murray said. That's what DeLauro said. They did not discuss it with us at all. So to say the appropriations process is working is wrong. It's not working. It's not working because the leaders wouldn't discuss it with us, as we discussed with Republicans on every single one of these, what should be in the bill and add to the bill. Please.
So the senator from New York, the way that we've done it, and it's a different business model than the one he used, we actually have the Appropriations Committee sit down. And the date that they came up with, November 21st, was agreed upon by the House and Senate appropriators, Republican and Democrat.
Would the Speaker yield? Would the leader yield?
I will. And the Ukraine issue you're talking about wasn't a CR. That was an entirely different issue. So don't throw that into this mix.
It was not.
But
It was
what we
not
were
an
talking
entirely
about,
different
the
issue.
Democrat leader and his colleagues have the same leverage on November the 21st. This is a short-term CR. This is what we do all the time around here, as witnessed by the chart that you're just using there. 24 pages long, funds of government till November the 21st, at which time you have the same leverage then that you have right now, and we have until the end of the year to fix the ACA credit issue. And we're happy, as I said yesterday, and I've said on multiple occasions, to sit down with you to do that.
Thank you. Now, reclaiming my time.
Nice.
They did not agree to the bills that the leader is talking about because they said explicitly, Democrat and Republican, there are two issues they can't resolve: impoundments and rescissions, and ACA tax credits and health care. And they all agreed, the four of them, that they couldn't agree to a bill until the leaders discussed it with us. We asked the leaders to discuss it with us in July, in the middle of August, at the end of August, in September. They refused. And now he says, give us another 45 days. Well, frankly, the Republicans have had 45 days since March. One 45 days, another 45 days, another 45 days. And in the room yesterday, Johnson said he doesn't want to do it at all. He doesn't want to have any compromise. So the time to do it is now. And the idea that we can do it till January, when we talked to the president yesterday, he didn't understand this. But I know that the leader does. On October 1st, in a day or two, millions of Americans, millions, are going to get notices that their insurance premiums will rise an average of $400 a month, $5,000 a year. A middle-class family can't afford that. We want to renew those credits, among other things in health care, but renew those credits so that people won't pay that horrible increase. You can debate health care all you want, but the overwhelming majority of Americans, Democrat, Independent, and even a good number of Republicans, want us to renew those credits. And the impoundment rescission, I mean, what does the leader think? That we should go along, come to an agreement, and then let them undo it unilaterally as they've done once and now have asked to do it more? No way. That's not how you deal with this, and we never had another president who did it. So I repeat, I love this chart. Democrats negotiated with Republicans. Democrats negotiated with Republicans. Democrats negotiated with Republicans, and on through the whole chart. Didn't happen this time. Leader Thune did not come once to me and say, is this bill acceptable? What do you want in the bill? So they call it clean. We call it extremely partisan. Not one discussion, House or Senate, between the two leaders. That is not how you negotiate. And that is not how you pass appropriation bills. And the Appropriations Committee is stalled by their own admission because the leader will not come and talk to us about it. Now, let me make a few other points. Republicans are heading us into a shutdown. We stand at the precipice of a government shutdown because Republicans are not serious about keeping the government open. If you want one glaring instance of that, Speaker Johnson sent his people home. They're home right now, even though the government will conclude at midnight. There's only one conclusion you can draw when the Speaker sends the House home: that he wants a shutdown. He doesn't want to negotiate. All they want to do is force us, try to bully us, and they're not going to succeed, into taking their partisan bill, take it or leave it. That is not how this place works. And that's why we're headed into a shutdown, because Republicans refuse to negotiate a bipartisan bill that deals with the health care needs of the American people, which they care about. Yesterday, Leader Jeffries and I went to the White House to meet with the president and Republican leaders about finding a way out of this impasse. It was a frank and candid discussion. It was long overdue. As I said, we'd asked for it for months. We asked the president to meet with us when Thune and Johnson wouldn't. He said yes. And according to all reports, Johnson and then Leader Thune, who just followed what Johnson wanted, said, "Don't do it," and the president withdrew. So on Friday, I called this Leader Thune and said, "Let's have a meeting," and we did, but it's at the last minute. There's still a chance. It's only the president who can do this. We know he runs the show here. And he's got to say to our Republican colleagues, deal with this ACA issue so that people don't get $400 premium increases. Deal with this impoundment and rescission issue, which when we told him about it yesterday, he seemed not familiar with it, but now he knows. And we can solve this problem. But Johnson won't, Thune won't, and so the president is not going to be able to persuade them unless he tries at the last minute. That's the only hope here. Look, sitting in the room with the president, it was very clear that the president hadn't fully grasped the magnitude of the disaster he's causing when the government shuts down. As health care costs go up, as people lose their health care, rural hospitals are already closing. Speaker Johnson in the room said to me they're not, and I pointed out to him that Tim Kaine just informed us that 3 rural clinics in Virginia, Southwest Virginia, were closing. And the head of those clinics said it's because of the bills the Republicans passed. The so-called BBB, which we know is not beautiful. The American people know it's not beautiful. And so they know, our Republican colleagues know that the American people are fully behind us when it comes to lowering costs, but also when it comes to health care and making sure that those premiums don't go way up. And then I spoke to Speaker Johnson directly in the room. I told him, because he can't debate health care, because he knows it's not, the American people are on the side of wanting these increases, even Republicans, I told him to stop making up stories that too many Republicans are lying through their teeth. They say, oh, the Democrats want undocumented immigrants to get health care, to get the federal dollars of health care. That is utter bull, and they know it. The law prohibits undocumented immigrants from getting payments from Medicare, Medicaid, or the ACA. There's no money, not a penny, of federal dollars that are going there. So why do they bring this up? Because they're afraid to talk about the real issue, which is health care for American citizens, health care for people who need the health care and can't afford these premiums. Let me say it again. Undocumented immigrants cannot receive premium tax credits by law. So they should stop these lies and address the real issue, which of course they're afraid to do. A standard Republican MO. A standard Republican MO is to make something else up because the American people are on our side. Now, this week, here's what House Republicans sent out guidance to their members. They said, quote, not to make the message about health care because Republicans lose that argument. They're right. Their position is callous, malicious, unpopular. So they're not only refusing to talk about health care, but apparently when they do, it's only to spread misinformation, to spread lies. I said this to Speaker Johnson in the Oval Office yesterday. I told him it was total bull, I think that's the word I used, to say that we want undocumented immigrants to get federal benefits, that it can't happen by law, and nothing we've proposed in our bill changes that. He sort of smirked, that's it, because he knows the truth. He knows the truth. And they're lying to the American people, these Republicans who use this, because they know how unpopular their position is. Kaiser Family Foundation poll, 75% of Americans support extending the ACA premium tax credit, including 63% of Republicans. Republicans have chosen the losing side of the health care debate because they're trying to take away people's health care. They're going to let people's premiums rise. And this idea that we can do this at January, no. The notices go out October 1st as to how much increase people will get in 29 states, and they only have a short time, long before January, to decide, are they going to drop their health care because they can't afford it? Are they going to take a lesser plan where they pay more through deductibles and co-payments? Or are they going to keep that plan and cut back on buying a car, going on a vacation, or worse? Republicans have simply put, folks, the Republicans have chosen the losing side of the health care debate. Losing side. And in the White House meeting yesterday, Speaker Johnson made it perfectly clear he didn't care if people's premiums should go up, because his conference is against it. And so again, the House isn't even set to come back until October 7th. You tell me which side is actively manufacturing a shutdown. Why did the House do that? Because they wanted to negotiate? I don't think so. They wanted to jam it through, but they're not going to be able to. Yesterday, during a House Republican conference, Representative Lisa McClain made it explicit. She said, don't talk about health care to her Republican colleagues. They don't want to talk about it, so they make these other things up, facts out of thin air. So the Republicans have until midnight tonight to get serious with us about solving this crisis and keep the government open. But right now, they're not even talking to us seriously. They're sort of in la-la land. And then on another issue, related. Yesterday, the president posted an offensive deepfake AI video of Leader Jeffries and me, with sombreros, fake music, impersonating my voice through AI, it wasn't me, talking even more lies about health care and immigration. Listen to this, America. Hours away from a shutdown, which we don't want, the American people don't want, the president is busy trolling away on the internet like a 10-year-old. And that's exactly why Americans are going to blame him if the government shuts down. That's another proof point as to who is to blame. His video, Johnson going away, and adjourning the House till next week. We have less than a day to figure this out, and Donald Trump is busy tweeting deep fakes. It's not like he's in touch with reality, he's in a bubble. He doesn't understand that if the government shuts down, people's health care premiums will go up. When we told him about it, Hakeem and I, yesterday, by his body language, he seemed not even to be aware of it, of the ramifications. If the president was smart, he'd move heaven and earth to fix this health care crisis right away, because Americans are going to hold him responsible when they start paying $400, $500, $4,600 more a month on health care. So we have less than a day. If there was ever a moment for Donald Trump and Republicans to get serious about health care, it's now. But even right now, even this morning, even here on the precipice of this crisis, the president would rather troll on the internet and lie about health care than tell the truth and get to work. So that's why the polls are abundantly clear that Americans will hold Donald Trump and Republicans responsible if the government shuts down. Senate Republicans could stop this crisis now. The president should get on the phone with Leader Thune and the Johnsons and tell them to work with Democrats to fix the crisis before it's too late, and work with Democrats to fix our health care crisis. Let me just say once again, we tried over and over and over again to meet with the Republican leadership. They said no. The appropriators said they couldn't resolve the issues until the leaders met. So we asked the leaders to meet again, and they said no, because they didn't want to negotiate. They wanted it their way or no way. Their way or no way. That's not how the Senate works. If Republicans cause a shutdown, they'll probably keep lying and distracting because they know we're on the side of the Democrats are on the side of the American people. But we will continue to focus on health care, and the American people will be completely on our side. Yield the floor.
During remarks on the Senate floor Tuesday, Senate Minority Leader Chuck Schumer, Democrat New York, debated Senate Majority Leader John Thune, Republican South Dakota, regarding the ongoing discussion around a continuing resolution as a government shutdown looms closer. Schumer began by pointing out the lack of bipartisan negotiations on the recent appropriations bills. He criticized the process, stating that Democrats were never consulted or included in the discussions. He reflected on past negotiations with Republicans, where there was an attempt to find common ground on bills, but this time, that approach was absent. He provided a specific example in which a bill had to be altered to remove aid to Ukraine after discussions with Republicans. However, Schumer emphasized that such negotiations did not happen with the current appropriations bills. He singled out key issues, such as extending ACA, Affordable Care Act, tax credits, and addressing rescissions and impoundments, which were not brought to the table by Republican leaders for discussion. Despite multiple requests from Schumer and others to meet and negotiate, he claimed that no meaningful conversations took place. A critical point in Schumer's speech was his warning about the upcoming rise in healthcare premiums for millions of Americans. He made it clear that failure to renew ACA tax credits would lead to an average $400 increase in premiums per month, which he argued would be unaffordable for many middle-class families. Schumer pointed to Republican inaction and argued that they were pushing the country toward a government shutdown. He referenced Speaker Johnson's decision to send House members home, interpreting it as a sign that Republicans were not serious about keeping the government open and were instead forcing through partisan bills. Schumer also accused Republicans of spreading misinformation, particularly on issues involving undocumented immigrants and health care. He pointed out that claims about Democrats wanting undocumented immigrants to receive federal health care benefits were false. By law, undocumented immigrants cannot access ACA tax credits, Medicare, or Medicaid. Schumer highlighted how Republicans were using these false narratives to avoid confronting the real issue, affordable health care for American citizens. Schumer further emphasized that public opinion was overwhelmingly on the side of extending ACA tax credits. A recent poll showed that 75% of Americans supported the extension, with a significant portion of Republicans also in favor. He argued that Republicans were on the losing side of the healthcare debate, trying to take away benefits that Americans rely on. As the debate continued, Schumer highlighted the Republican leadership's refusal to engage in meaningful talks. He noted that both the House and Senate Appropriations Committees had expressed that they could not resolve the issues until the leaders met. Despite repeated requests, Schumer claimed that Republican leaders refused to negotiate or meet with Democrats, choosing instead to push for bills without compromise. In closing, Schumer stressed that if Republicans continued to block negotiations, they would be held responsible for the government shutdown and the rising healthcare costs Americans would face. He urged for immediate bipartisan cooperation to prevent a shutdown and address the healthcare crisis before it escalates further.